for any kind of pelvic landmarks, I'm going to start with the iliac crest. So I'm going to come in, find the iliac crest, okay? And then my thumbs are going to drop in and they're going to land on the posterior superior iliac spine, or the PSIS. Okay? So if you look at our skeleton here, I'm here, my hands are going to drop down, and this is the PSIS. So it's the most prominent part of the posterior iliac crest. Now, this is also very broad, and I said this to some people, but not to everyone. The ASIS also can be very broad on people. So what I do is I come in and I put my thumbs under and press up so that I'm always in the same place all the time. Because if I were palpating on the surface, I might just be a little higher or lower on one side, and then I will misinterpret that finding. So I come under and push up so I'm in the same spot. The same is true for the PSIS. I'm going to come in with my hands and I'm going to go underneath and press up. Now, for some of you, I think I said this before when we were palpating, but if you find the iliac crest and you come over, you're going to hit that L4, L5 interspace, okay? So then you can, this happens to be perfectly lined up, but it could be lined up differently. So, but you know this is going to be either L4 or L5, and then you can palpate down. The sacrum will have a bony prominence, because these were vertebral segments that fused, right? So it's going to have a bony prominence, but it's not going to be nearly as much as this. It's also not going to have as much movement, okay? So you'll know you're on the sacrum. So we're doing iliac crest. We're going to come across, and we're going to find those PSISs. On some people, there will be a dimple there, okay? And you want to catch underneath there. Now the PSISs are going to be important because we're actually going to draw a line there and use that for measuring spinal movement. We're also going to be using the PSISs to look for that iliac motion. So we're going to compare what we see here to what we saw with the ASISs as well. Okay? Now from the PSISs, if I roll off the PSIS medially, I'm going to hit the sacrum, and that's called the sacral base. Okay, so it's kind of goofy that the top part would be the base. So from the PSISs, I'm going to roll in, and now I'm on that sacrum. And Emily is a little tight on this left side. This is my favorite classes. I get to find out all these things that are going on with all of you. Now, I'm going to palpate down along the sacrum. So now I'm just moving my thumbs down. Where there is a sharp turn coming in is called the sacral angle. Okay? Now, the reason that the base and the angles are important is because the sacrum moves in really goofy ways. And so you're going to be looking for anterior, superior relative to each other here, and then also here. Okay? So I'm palpating down, I'm on her sacral angle. If I keep following her sacrum down, I'm going to fall onto her coccyx. Okay? And so you're palpating that for positioning and for reproduction of symptoms. People who've had a traumatic fall, sometimes in pregnancy, you can actually have the coccyx either get fractured or dislocated, and that can be extremely painful. So you have to be able to palpate that to make sure you're not reproducing symptoms. Mobilization of the coccyx is done intraanally, which we will not be performing in this class. But it is something that is done frequently in women's health that's, again, super critical to help those patients get better. So it is for those people who have that skill set, it's really, really important. You didn't know you're volunteering for that, did you? So those are the structures of, so we have iliac crest, PSIS, the base of the sacrum, the sacral angle, and the coccyx, okay? So another structure that we're going to palpate are the ischial tuberosities, or your sits bones. Do you guys know what major muscle attaches? Hamstrings attached there. We're also going to use that to look for symmetry of the pelvis. So you're going to come to the gluteal fold and press up, and you're going to land on those ischial tuberosities. And again, you're looking to see if one is superior or inferior to the other. okay? So those are ischial tuberosities. The other thing that's really important to palpate on the ilium is the sciatic notch, okay? So this is where the sciatic nerve, which is a combination of many of the nerves in the lumbar and sacral spine, come through and run down your posterior leg. So if you've heard of sciatica, okay? If it's true sciatica, that means something is pressing on the sciatic nerve right here. And typically that's going to be the piriformis, although not always. So you have the muscle that is a hip external rotator that lies right directly over it, and we'll palpate that when we get to the hip. But that piriformis, if it's tight, can compress on that nerve, causing posterior leg symptoms. Okay. Now there's two ways to find that sciatic notch. You can go to the sacral angle and come laterally and find that with the patient in prone. Catherine. So I found the sacral angle and I find the ischial tuberosity and I come over. Okay, so right there I'm in it, because if I go up, I'm in the notch and I'm pushing up. Okay, and now if I were in soft tissue, I wouldn't get the movement of the pelvis that I'm getting. Okay, and I've lost it, but you can find it there. If people have relatively good flexibility, you can also have them go in sideline and bring their leg up and over and palpate it there. But I'm not going to have you do that, okay? I have two more ligaments. I guess I'll go ahead and do those. So the sacrotuberous ligament is going to go from the sacrum to the ischial tuberosity. So it's nice when ligaments are named for what they attach to. Right, so again, we're going to find that sacral angle and the ischial tuberosity. And we're going to go right between them, and we're going to go cross fiber. And Emily, do you feel that I'm rolling over it? Mm-hmm. It's right there. The sacrotuberous ligament is pretty thick, and so in some people you'll be able to find it quite easily. Okay, so it's one of the longer ligaments that's thick that would be a nice one for you to palpate. The iliolumbar ligament really is almost more a thickening of fascia than a true ligament. So if you go from the iliac crest, so we're here, to the lumbar spine, you're going to see some fascial thickening that goes this direction. So that's not so much going to be a ligament. So here what you're going to want to do is go cross fiber. So if you imagine, sorry, I just put my back to everybody. How I would want to do it is I have iliac crest, lumbar spine, and I want to be cross fiber obliquely, which would be standing basically with my back to Aubrey, okay? And then pressing there and going cross fiber for that, okay? So we had iliac crest, PSISs, sacral base, working down to sacral angle, continue working down to coccyx, ischial tuberosity, sciatic notch, sacrotuberous ligament, iliolumbar ligament. Okay? We're going to cover a lot of the muscles of the gluteal region when we cover the hip. Are we good? I think I got them all. Okay.